Since joining with you guys and using your services, we went from about 40 new patients to anywhere 90 to 110 new patients a month.
Going to this new location, bigger place, more space, more doctors, more patients. What are your goals for this new location? My name is Colin from Gravity Dental Marketing. Today I am here with one of our clients from Columbus, Ohio, Dr. Jerry Cheung of Bright Smile Dental. The reason we're here today is Dr. Cheung is upgrading. He has purchased a larger, brand new dental practice. We're here to tour it and talk about his goals and his plans for the new space. Dr. Cheung.
Thank you. Thanks for having me.
So your new space, how much bigger is it than your old space?
We're growing from a 2,000 square foot location to a 7,000 square foot location. So we're basically tripling the size.
Tripling the size.
Tripling the size of our practice.
Wow.
I've been in the old place for about 10 years and we outgrown it.
10 years, you've been in the old place. I think we met 4 or 5 years ago?
4 or 5 years ago.
Yes, when we started your marketing.
Yeah.
When we first met, we had our introductory meeting as we always do. We talked about your current practice, your current marketing, and your future goals. Correct. So that kind of brings us to today. What were your goals 4 or 5 years ago?
I knew that I wanted to expand and grow and serve more of my community. Since joining with you guys and using your services, we went from about 40 new patients to anywhere 90 to 110 new patients a month. So it's been very effective in bringing new clients, and with some of the training we have for phones that helps capture them and make appointments for them.
That's right.
Yeah.
So marketing isn't just about getting your name out there, getting phone calls to the front desk.
Correct.
It's also about making sure your front desk is answering the calls correctly and giving a good service overall so you get a good review afterwards and then the referrals come. Going to this new location, bigger place, more space, more doctors, more patients. What are your goals for this new location? Expansion, new services, more patients per month to serve your community better? What's the main goal here?
Number one goal is to wow our current patients, and so that they can tell their friends about us. And then the more people we see, the more people we serve. It doesn't matter if you're the best cook or restaurant on the neighborhood, but if nobody comes see you, they'll never find out how great you are.
True.
So we want the word of mouth. We want to be able to help our community and become. This is going to become my legacy practice. Hopefully, one of our doctors or somebody will pick up and carry on tradition in providing good dental service to our community here.
What are the plans for this new location as far as design and helping your new patients?
Currently, we are working on the finalizing design plans. We're going to basically demo this whole entire building, this internal area, and we're going to build it from the ground up internally. So all these walls are going to be gone. We're going to reconfigure everything so that it flows very well, and we're going to have a nice waiting room for the patients and amenities for them too. And we're going to have 2 dedicated surgery rooms.
That's right. We're going from how many patient rooms?
We're having from 7 patient operatory rooms to 16.
7 to 16. Wow.
Yeah,
okay, so more than double.
More than double.
Yes. Can you talk about in the past where we've added new services for you, like wisdom teeth or cosmetic, something that we found from a competitor, something that you wanted to add? Can you talk about how adding new services works through us and how you saw those patients come in after adding the new service?
Oh, absolutely. After we started advertising for more surgery patients, our number of inquiries for surgery went up, and we started performing a lot more surgeries for our patients. We discovered that it's underserved here in this community. There's not enough oral surgeons out there, so their wait's about 2 to 3 months, and we can get them in within weeks. So that was a great service for our patients, especially those who are in pain. So having them being able to find us allow them to come and get treated. Otherwise, they would have been waiting for 2 or 3 months.
Let's walk, let's talk, let's see what it's all about. Sound good? All right.
Sounds good. So this will be the future waiting room. It's going to extend from here all the way down to the door over there. Our new front desk, check-in desk, will be probably from here, over here, up to there.
Okay, so like that whole space we were just in is all going to be waiting room for the new patients.
Yeah.
These walls are going to be gone.
All gone.
Awesome.
Be wide open. And then we're going to have operatories lined up across the window on this bank of the building, and then operatories down that way as well.
Okay, let's continue through, even though none of this is going to look the same pretty soon.
No, but
at
it's
least
good
we'll
to
get a
see before and
sense of the
after.
awesome size.
Come on in. The restrooms are here. We're gonna keep the walls and the restroom in place, but we're gonna redo the inside of them.
Okay. So it's pretty much going to be a full gut, essentially,
yeah.
from top to bottom.
From top to bottom.
Nice.
Yeah.
Nice. All right.
If we can, we're gonna raise the ceilings. This will be a hallway, and our operatories will be down, the banks will be down this way. We will have a office space here. Down here will be sterilization where they process our instruments.
Okay, okay.
So we'll make it very efficient. So this will be like one of our hygiene wings, and then the doctor wings on the other side.
Okay, so kind of an order of operations, the standard hygiene stuff,
Yeah.
maybe
So you
more
don't-
complicated surgeries back in the back.
Correct.
And then all the way around.
And then our
Okay.
private room back there will have for surgery room.
Right now, you're doing maybe 100 new patients a month, about?
Yeah, about.
Essentially?
Yeah.
What's the goal for the new place?
I'm hoping within 6 months we'll jump up another 20%.
Okay.
And then after a year, probably 150 to eventually 200 new patients.
200%.
a month.
That's great. That's great.
Thanks.
Well, thanks for being here, Dr. Jerry. I appreciate you.
Thank you.
Thanks for being with us at Gravity Dental Marketing. We
Oh,
love being
we
a
love
part
you
of your
guys.
team.
Yeah.
We look forward to the future. There's going to be more bright smiles in the future from Dr. Jerry Cheung at Bright Smile Dental. So thanks again for your time today.
Thank you. It's a great partnership.
Yes.